We're moving on to topic Tuesday. All right. I think this is from Adam. I know, read it exactly as Adam put it, but he did something very interesting this week. He did something very different than he normally does. Um, we just finished February, which was a pretty cool month of a lot. Look, there was a lot in February. It was Marfan Awareness Month. It was heart valve disease. It was just heart health in general. And we did a lot of conversations about heart valves and just different stuff, right? So his post this past Tuesday was kind of to talk about some of the stuff that Duke, who is almost ready to probably announce where he matches for his residency. That's exciting. This is kind of a play on some of the posts that he did. And if you need to do a quick glance to the week before's post before you answered his quiz questions, that's fine. But he did post some trivia questions, so let's take a look at those. So let's see. There's a nice diagram. Kind of put that diagram in your mind. Okay, look at that. Ooh, something changed on that diagram. See? Which aortic root surgery, Bentel or David, allows you to preserve your native aortic valve without replacing it? Do you know the answer? Because I don't.
I don't, but 50-50 makes me say David.
And I'll say Bentel because I don't remember the answer. I don't. But we're going
I
to
just
figure it out.
produce. I'm a producer.
I'm just a reader. And I do produce content, but I can only allow so much information in my brain because it can't process anything else. Anyway, we're going to figure out the answer in a minute. But number two, I think Molly got all the questions right. So hats off to Molly.
She would.
She was really excited with herself. And if there is a button that says, I am tooting my own horn, she pushed that one. She pushed it. All right.
Love Molly.
Yeah. During aortic root surgery, two vessels are removed from your root as buttons and later reimplanted in the synthetic graft. What was the name of those vessels? I actually read that and was like, are we sure we posted whatever post they're referencing? I have no idea what they're talking. What is a button? I don't know what they're talking about. But I can't wait to find out the answers, and we will find them out in just a second.
Oh, you know what's making me wonder if this was the one that Molly read.
It very well could be.
Right?
That's why she knew the answers.
That's
cheater.
Why. Oh, we have to wait for her to chime in.
Yep. Number three. What's the full name of the surgeon for which the David procedure is named after? I don't know. But I don't have to know to do this job. I just read. All right, number four. Which aortic root surgery is used to treat patients with both aortic root disease and concurrent aortic valve disease? Mm-hmm. Mm-hmm.
And Molly was nailing all these?
Nailed them. And when we read them, we're going to be like, oh.
I'm sure we know these words. We say these words.
We say them. And I can say these words without
but we don't know these words.
I don't get paid. I get paid this much. I definitely don't get paid enough to know. But how many leaflets does a normal aortic valve have? I know.
Trace.
You know. Thrice. Right. 3. When an aortic valve has 2 leaflets or cusps, what is that called?
That is a bicuspid. See, now we're in the elementary part of things.
Okay.
Yeah.
We just finished with the high school. We're in elementary school.
Yeah.
All right. What's it called? What is it called when your aortic valve is too tight?
Is this aortic stenosis? Thumbs up for that one.
Ding, 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 my friend.
I win.
You win. And what is it when it's too leaky?
Oh, is there a word for this? A leaky regurgitation.
Yeah.
Aortic regurgitation.
How'd you like that?
Oh, I was looking at my ceiling fan going, give me the answers.
Yes, regurgitation. True or false? Younger patients are more likely to have aortic valve disease.
Oh, you know what? This is funny because I want to say it's true, but I only want to say that because they find it because it's acting up. Whereas most regular people will have a plumbing issue due to time versus an unfound connective tissue disorder or a genetic component.
See, my gut would say false because I would think that as we age, our valves start to have problems,
Mm-hmm.
but that seems too obvious.
See what I mean?
See what I'm saying?
That's why I have all the strings on the wall.
But number 10, true or false? Only around 1 million Americans have heart valve disease currently. I'm going to say false because I don't know why. Because I think the word only makes me think he wants me to say true, but it's
Interesting.
probably like a million point one. So
Yeah, I only
say
know
no.
enough to know that we're at what 15,000 a year are aortic dissection
Yeah,
survivors, and that's the number that I fall back on.
sure. But
But
would you like
yeah,
to know
like I
the
feel like it
answers?
could be so many more. Where are the answers?
I'm going to show them to you right now.
Okay.
Put them out of order, but let's do it. All right, here's your trivia answers. Okay, let's go. Which aortic root surgery, David or Bentel, allows you to preserve your natural aortic root without replacing it? And the answer to that is
David.
the David procedure. It's also known as the valve sparing root uh, replacement
Right?
procedure,
And
which is
I
what I
always
had.
thought that Bentall sounded like a device.
I think it sounds like regurgitation medication.
Oh, okay.
Or, you know what it sounds like? Cream. Isn't there some kind of aspirin like cream you put on your sore muscles that sounds like Bental?
Don't know. I use Tiger Balm.
Mm, that stuff's good. All
I
right.
know.
During aortic root surgery, two vessels are removed from your root as buttons and later reimplanted in the synthetic graft. What is the names of those vessels? And they are
The coronary vessels.
coronary. There you
He just
go.
needed to be more specific.
Yeah, that was hard. And so he's in trouble. What was the full name of the surgeon that the David procedure is named after? Tyrone David. Never knew that, never heard it, and never read it. So I must have been off that day.
Well, somebody had to have written it.
Somebody wrote it. I don't
Yeah.
know. Which aortic root surgery is used to treat patients with both aortic root and concurrent aortic valve disease? That is the Bentall. And I
Oh, is it?
know because
Did he
I
do?
looked
This
at
is
it.
so pro. It's so pro to leave the answers in the test.
All right, I'm looking ahead. 3 bicuspid aortic. We know this. Yes, we know
Yeah.
this. Which we said normal is
Tricuspid.
3.
Yep.
When it has 2, it's bicuspid. When it's too tight, it is stenosis. Too leaky, it's regurgitative. All right, younger patients are more likely to have aortic valve disease, and true or false, only around 1 million Americans have the disease currently. So, false and
It
I
is
was
older
right. What? It
patients.
was less than 11 million. Okay, so false. So, younger patients are not more likely to have it. I was
Huh.
right. And false, greater than 11 million Americans have heart valve disease currently. Greater than 11. How's that?
Yeah.
That is a lot of people. It's a lot of people. And the crazy thing is you may not have any symptoms. It's kind of just like having an aneurysm, which is
Yeah.
scary when you think about it.
Yeah. Unless, the
Yeah.
regurgitation makes noise and somebody catches it
Yeah.
listening.
They hear like a murmur,
Yeah.
right? Sure.
Right.
True.
Unless.
We were having
Think about how lucky
some
they are.
super lucky, or you're
Yeah.
getting some edema, like retaining fluid. That could be a symptom. Just got to have good doctors that pick up on symptoms and start thinking all the different things can be. The human body is pretty amazing.
See, I hear what you're saying there, but there's also a
Yeah.
part of me that wishes that the CT scans were in every urgent care facility.
As well as an ED. Yeah, well, because CT is so quick. But
You
is it
know?
really, if you got to pre-medicate, they don't have place to put people in patient
Well, I
first
mean,
centers.
I'm just saying, if you don't have to
Hmm.
pre-medicate, you know,
Let's go for a quick 5-minute scan, right? I
right?
don't know.
And also, like, even if you do have to pre-medicate, like, which one? Like, do you want to go to the ER? Like, if you can call ahead and prep, and they have a file on you, and they know who you are, and they're following you, that's like the dream of Think Aorta, to empower those
Yeah.
emergency responders with corrective action.
Yep.
But these
Well,
things are prohibitively expensive.
yes. Stupid. It's
Yes.
stupid. It does. Do you know, it's like, why are we still paid tolls when you know that road's been paid for or the bridge long ago?
Mm-hmm.
Parking lots. I know that parking lot of that hospital was paid for. It's been around over 60 years. Why am I still paying them $2?
Mm.
Why do these scans have to be so expensive? You know that machine's been paid for. I don't
See, and
believe it
and
costs that
also
much to
and
use
also
it.
like and also like the imaging, right? Is this better than an X-ray,
Well, yeah,
right?
sure.
So, like,
Yeah.
is it faster than an X-ray? So why are we still
Yeah,
fostering X-ray technology? Do you
because
see
we're
where I'm going with
dumb.
this? Do you see
Because
where I'm
we're
going with this?
dumb. Not
Like, get me
we,
to the. I want to like
people
in
dumb.
my industry, there's a term called fail fast. Okay, and the idea
Yeah.
is if you have a grandiose idea, the sooner
Hmm.
it doesn't launch, the better, so you can pivot
Right.
to the next action. So when it
Pivot.
comes to diagnosis and imaging, if
You
there is
said pivot.
already a fantastically modeled, more efficient way to do it, what are we doing?
Yeah. But you said pivot, so you lost me.
Well,
You
when
gotta
when I
be
pivot,
friends.
you have to like your attack vector is off, so you have to transition to
No,
the next
you
attack
have to
vector.
know friends to understand why my head is. Did you not
Oh
see that
goodness.
episode where
Maybe.
he
Is this
was
the
trying?
chair? Is this the chair trying to
He's
go through
trying
the
to move the
hallway?
sofa
Yeah.
upstairs, and he just
Pivot.
pivot. Okay,
Pivot.
all right, we're moving
Right.
on.
I'm glad I lost
Exciting.
you.